you're using our patient education material right now, this is what it's going to look like. So you'll click on the Patient Ed button, and you'll get this tiny little screen that probably looks like a little dot on your screenshots there. So here's the patient education series right here. This is where you'd be able to find which, and this is actually, these two screens right here are done behind the scenes. You don't get to see those done because when you're in a patient's chart, it automatically determines what record to pull those from. So it's pulling that from the elderly catalog of documents, or it's pulling from the pediatric documents based on the patient's age and sex. So that's what that's showing right there. And then down here is the actual documents that you can print or email to the patient. And email is fine because it's education materials. It's not actual, it's not their lab data or anything like that. If you're using this patient education, as soon as you print it or email it, it's going to automatically document it. If you're using an external patient education resource, then there is going to be an item that you're going to need to use. So there's going to be a new dot code added. So .ed:"patient-specific education material provided," and then you'd be able to click yes or no, and then that would be a way that you can get credit for using an external patient education material right there. So through that dot code. And if alternate patient education materials are used, the flag can be set by the user so you can actually mark those that the patient education resources have been provided. So that's if you're not using the McKesson Relay Health patient education stuff, you can actually check that flag so that that will mark off when you print that out for a patient. Patient education, the measure for this one is more than 10% of all unique patients seen by the eligible provider are provided patient-specific education resources. The subset that at least one encounter in the reporting period and the reporting provider is the encounter provider. The numerator is the subset of patients where the patient-specific education resource flag is marked. So that flag's automatically marked with ours. If you have an external, you have to click that. Or you can use the dot code.